And now, for more on how the climate crisis is impacting India, let's head over to Delhi, where Gargi Rawat is live in studio.
All right, thank you so much, E. Yes, I'm Gargi Rawat from New Delhi Television. I'd like to say that we're very proud to be a part of this entire effort, this television event on climate change. Now, joining me today is Dr. Poonam Singh, the Regional Director of the World Health Organization in Southeast Asia. We're talking about the impact climate change is having on the health of the public, and no one better to talk about that than you. So tell us, Dr. Singh, that it's talked about the many ways that climate change is impacting public health, especially when it comes to vector-borne diseases and their increase and as the climate is changing. And what are the populations that are most vulnerable to this in the Southeast Asia region?
Undoubtedly, climate change is a huge kind of challenge for the 21st century. And even though awareness is increasing, yet what is most important is to address the health risks of climate change. And coming to the impact, what you raised, I would like to look at it from two perspectives. There are some direct impacts of climate change, and there are some indirect impact of climate change. Let's look at the direct impacts first. And looking at that, we find that there are physiological changes that occur with rising temperatures, which can lead to non-communicable diseases like respiratory diseases, cardiovascular diseases. The Southeast Asia region is also prone to natural disasters. We do find a lot of floods, earthquakes, there are
torrential rainfall, or monsoon.
Like we just saw, and this does happen in this region. And what has happened with climate change is that the intensity of these and the volume and the frequency of these has gone up. And therefore, we need to address that part of it, which we are doing, trying to build resilient health systems so that when there are these kind of disasters, we can address them. We've also seen of late that there is the pollutants in the environment are going up. We do find that that itself has a huge effect on people's health. And again, it is really cardiovascular diseases. It's again respiratory diseases. We do find lung cancers coming up. The numbers of lung cancers has gone up. These are some of the direct effects. Now, looking at the indirect effects of climate change, there are some ecological factors. There are large population displacements which occur. And we also find that water shortages come up, food shortages come up as a result of climate change. In trying to see that who is, or let's come to the question of vector-borne diseases first.
Yes, that's something we've seen really going up in recent years.
It has, because vectors are not only expanding in rising temperatures, vectors are also changing their locales in expanding in these rising temperatures. And we do find areas where we did not have, say, malaria coming up, in high locales which were colder and where we did not expect malaria. Or malaria was really out of the way there. And I find that in Bhutan, Nepal, we did not have malaria the way we then started getting malaria episodes. Dengue is so much on the rise in the Southeast Asia region. Almost every country of the region is facing dengue. So,
and again, a mosquito-borne disease.
Absolutely. So vectors, therefore, thrive in these rising temperatures and expand. Now, who gets worst affected? That was your next question.
Right. I mean, that is what the World Health Organization, they work for the disadvantaged population. So where would you start? What would you do to improve public health among the poor?
Now, if we look at the Southeast Asia region, it is 1/4 of the world's population. It has 30% of the world's poverty. It has over 30% of the disease burden. And it, therefore, is very prone and worst affected by these kind of changes in the climate. The poor, as it is, are disadvantaged. They live on the periphery. They live in areas where there are unsafe working conditions. They are facing a lot of problems as far as governance structures are concerned. They have very little role in decision making. Therefore, they are the ones who really get the worst affected. And we in WHO try our best to see how we can help those which are worst affected by building capacity in them to be able to address these challenges. And by giving technical assistance to countries and to those living at the periphery through the countries of my region to ensure that, yes, there is some way in which they can adapt to climate change.
All right, now Southeast Asia is said to be a regional hotspot, when it comes to the climate crisis. There's high exposure to several, factors from extreme weather events, which we talked about. Al Gore also just spoke about the various extreme weather events that India especially has witnessed in recent times. There's food security issues, there's high poverty rates. So how can you discuss how the health impacts of these various living conditions, and what solutions as the World Health Organization do you see to these issues?
Now, when we look at these issues and we look at the Southeast Asia region and looking at the World Disaster Report, we find that over 41% of the natural disasters in the world occur in the Asia region, and over 800,000 people get affected by these natural disasters. So therefore, this is a huge problem. And in trying to help them, we try to see how health systems can be more responsive. We start with health facilities and try to see that they are green facilities, meaning thereby that they are carbon-free as far as their designs are concerned, as far as the construction is concerned, so that there is the least chance of exposure from carbonization. We are also trying to see how we can help the poor in adapting themselves to these kind of changes, and by having training courses, by trying to see that first of all, awareness generation, because even if they've heard about it, they do not know how it's affecting their health. And therefore,
because these things are already happening. So I think now we just have to prepare ourselves and learn how to deal with these situations.
And very often they hear about it, but they don't know the nitty-gritty. They don't know really what's affecting them and what should they be doing. And therefore, through these training courses, we try to address these changes. And we try to also build capacity in countries so that they can go out and help as far as this is concerned. Now, we do know that there are measures that can be taken to address these, and these need to be taken rapidly so that the health risks from climate change can be addressed.
All right, and finally, universal health care. What is your view on that? And it's something that could help the poor deal with all these risks of climate change.
Universal health care means that we should be able to reach out to everyone. And as we keep repeating, it sort of implies that no one should be left behind. And that is what we push for. And that is what we are trying to do. Now, in trying to reach out with universal health coverage, we do find that there are still in our region at least 800 million people who do not have access to essential services. This is extremely important when we are talking of universal health coverage. And even though most countries of our region are trying to address this problem, and we do find an increase in the coverage of essential services, a large percentage is left out, and obviously they are the poor who are left out. If we try to see how many get into hardship because of this financial hardship, we find there are about 65 million in the region who are affected by this. So for us, for universal health coverage, it is extremely important for WHO to see that the poor are taken care of. Our latest global program of work addresses that. We are trying to see how we can reach out to 3 billion population to give them a safer place to be in, to promote health, and to cover them with essential services and universal health coverage. If you look at the SDGs, and SDG 3 in particular, that also is talking about that. So I think there is a lot of awareness now in the world about it. There are measures which are already available, and therefore now it's time to act. And my one-word message would be decarbonize. That would be the best way to address it.
All right, well, I hope they're hearing you in Poland there. But thank you so much for joining us and talking about this very, very critical issue regarding public health